Nah. Hi, my name is Esmeralda Jimenez, and I'm a student nurse from Rhodes, and I'm here to do your physical assessment. Is that okay? Okay. I'm going to wash my hands, and I'm going to close the curtain for privacy. Okay. Okay. I'm going to check my patient's two identifiers. What is your name and date of birth?
Gabriel Jimenez, 53002.
Okay, Gabriel Jimenez. Okay, I'm checking on my chart and my MAR, and I'm going to check his bracelet as well. Gabriel Jimenez, 53002. All right. Okay, I would have individualized my assessment to fit my patient's condition, his diagnosis, and his level of activity. I would take his vital signs, and I would check his assess for any tubes, for location, um, patency, color, odor, and consistency, and amount when assessing in his body areas. Okay, can you please sit down? Oh, can you sit down? Okay. Okay, Gabriel. What is your name?
Gabriel.
Do you know where you're at? Okay. Do you have any concerns or fears or any pain? No. Okay. So my patient is alert and oriented. There are no concerns, no fears, and no pain. His speech is clear and appropriate. Okay. Okay. Gabriel, I'm going to measure your pupils prior to dimming the lights. Okay. Okay. Now I'm going to dim the lights. Okay. Now I'm going to shine some light in your eyes. Okay. Turn back on the lights. Okay. So Gabriel's pupils are equal, round, and reacted to light. They went down from a 5 to a 3 millimeter. Okay. Okay. Gabriel, I'm going to check your upper extremities. Okay. Do you feel me touching you?
Yeah.
Okay, can you wiggle your fingers? Do you feel any numbness or tingling?
No.
No? Okay. Capillary refill. Okay. Skin surgery. Okay. All right, Gabriel. I need you to extend your arms like so. Palms up. Close your eyes. Okay. Okay. Now let's check his arm drift for 15 to 30 seconds. Okay. Now. Okay, Gabriel, are you right-handed or left-handed?
Right-handed.
Okay. Squeeze my hands. Okay. Alrighty. So, my patient's upper extremities are tan, warm, and dry. His sensation and movement are present. His capillary refill and skin turgor are less than 3 seconds. His hand grasps are strong and equal bilaterally, and his arm drift is negative. Okay. Now I'm going to listen to his heart sounds. Okay. I am going to clean my stethoscope. Okay. Okay, Gabriel. Okay. I'm gonna go to his sternal notch, to the angle of Louis, to the second intercostal space. His right, my left. Go second intercostal space, and I'm going to go to his aortic, and I'm going to listen with my bell and diaphragm. Okay. Now I'm going to go to the sternal notch, to the angle of Louis, to the second intercostal space, and I'm going to listen to across to the pulmonic. One, bell and diaphragm. I'm going to go to the sternal notch, angle of Louis. I'm going to go second intercostal space, third and fourth intercostal space to the tricuspid valve, and I'm going to listen with my bell and diaphragm. Then I'm going to go to the sternal notch, angle of Louis, to the second, third, fourth, fifth intercostal space to the midclavicular line to his mitral valve. Then listen with my bell and diaphragm. Okay. Now I'm going to listen to your aortic for 1 minute. Sternal notch, angle of Louis, second, 3, 4, 5, in between the fourth and fifth intercostal space with the midclavicular line. I'm going to listen to your aortic valve. And I'm going to listen for a minute. Okay. His rate was 72 and his rhythm was regular. Okay. Gabriel, now I'm going to assess your lung sounds, your anterior lung sounds. Okay, and I'm going to go from the sternoclavicular notch to the fifth intercostal space. 1, 2, 3, 4. Okay. Now I'm going to listen to your lateral sounds. Arms up. From your axilla to the eighth intercostal space. Listen there. Okay. Axilla, eighth intercostal space, and listen right there. Okay. Turn around. Now I'm going to listen to his lung sounds posteriorly. Turn around. Okay. Go down from a C7 to the T10. And I'm going to avoid all bony prominences. Okay. 1, 2, 3, 4, 5, 6. Okay. Move that way. Okay. Okay, now I'm going to assess my patient's breathing pattern. Okay. My patient's breathing pattern is regular with moderate depth, and his respirations and chest movement, his chest movement is symmetrical. Okay, can you lay down? Now I'm going to assess his abdomen. Okay, you put your arms down. Okay, I'm going to listen. Okay. Okay, and I'm going to palpate. Sorry. Okay. Alrighty, so my patient's abdomen is flat. His bowel sounds are heard in every quadrant for 5 to 15 seconds. They're active. His abdomen is non-tender, and there's no masses. Okay. Now I'm going to check my patient's lower extremities. Okay. Okay, Gabriel, can you feel me touching you?
Yeah.
Can you wiggle your toes? Can you move your legs? Okay, down. Alrighty. Okay. Alrighty. Gabriel, can you push up? Can you push down? Okay. Alrighty, so my patient's lower extremities are tan, warm, and dry. There's no numbness or tingling. His muscle tone is firm, and his sensation and movement was present. His pedal push and pull were strong and equal bilaterally. Okay, now I'm going to check his edema on a bony area. Hold that for 5 seconds. Okay, and there is no edema present. Now I'm going to check his pedal pulses. I'm going to check his dorsalis pedis. It's on the top here. Then I'm going to check his posterior tibialis down here. Okay, so my patient's dorsalis pedis and posterior tibialis, the pulses are present. They're strong and equal bilaterally. Okay, can you turn yours on your side, Gabriel? Okay, now I'm going to assess for skin breakdown, mostly focusing on his coccyx and his heels. Okay, so he moves in bed without difficulty. His skin over the bony prominences are pink, are tan, and intact. Okay. Okay, so now I would verbalize my findings with my patient. I would reposition the patient, and I would leave one side rail up. Okay, I would have his call light in reach. I would wash my hands, and I would go document. Okay. Alrighty, Gabriel, can you get on your side? Okay. Now I'm going to check my intramuscular injection sites. Okay, first I'm going to do his ventrogluteal. Okay, so the palm of my hand is going to be over his greater trochanter. My index finger is going to point up to the anterior superior iliac spine, and my middle finger is going to point towards the iliac crest, and I'm going to do, get closer. Okay, so the iliac crest and the anterior superior iliac spine, and I'm going to make the triangle, and I'm going to inject. Okay, get on your side. Go back. Okay, now I'm going to do his vastus lateralis, and I'm going to divide his thigh into thirds, vertically and horizontally. So I'm going to go 1, 2, 3, 1, 2, 3, and I'm going to check in the outer middle third, right here. Okay, can you sit down, Gabriel? Now I'm going to check his deltoid for his injection site. I'm going to find the acromion process, the lower edge of the acromion process right here, and then I'm going to form the triangle, and the comes down to the midpoint to the axilla, make the triangle. I'm going to check right there. Okay, can you lay on your belly, on your back? Okay, for his sub-Q landmarks, okay, they would be in the outer posterior aspects of his arms and his abdomen. They're going to be below the costal margins of the iliac crest and 2 inches away from the umbilicus. So like under his belly right there. Okay, and the other side would be in his anterior thighs. Okay.